Michelle Connor and I'm CEO and co-founder of Kinva. So Kinva is a software platform that digitally connects therapists and coaches and professionals with their clients and allows them to create tailored, personalised plans. So it's really about healthcare and life care, so health and well-being, so that it's delivered in a secure, personalised and connected way. So it allows for sort of a multidisciplinary input on the professional side, and then it all kind of streamlines down to just being on the patient or the client's device, usually their phone, so they have everything in one place for them. Well, our story is probably quite an interesting one. It did come out of personal experience. So my daughter is now 6, but when she was just over a year old, we were told that she had this really, really rare genetic syndrome. So it's called Kleefstra syndrome, and she was one of only 400 in the world diagnosed with it at the time. There was no information about it, no treatments, and so we were told initially that she would probably never walk or talk, that she would be very severely disabled. So that kind of took us on this crazy global journey. We went looking for help in lots of different countries, and we worked with physios and OTs and speech therapists and child development experts and nutritionists, and we just found as many different experts as we possibly could to help her. And what we realised was that the system over here just doesn't provide that level of provision, really, especially in those early years. And you need something quite rigorous and robust, and you need a lot of support around you to get really good results. And that was what we got for our daughter, that was what we got for Lydia. So what we found with all of that help and that support that we got, she's actually made really, really good progress. It's way better than we thought that she would. And that's really what Kinva is about. It's about providing that level of access to experts that may not be within your immediate location, that may be in some other random part of the world, and it allows them to digitally connect with you and to give you that support. And coming out of COVID, what we discovered even more so was that everybody's way more aware now of their health and well-being, that it's not just about being reactive about your health, but we all have a part to play in being proactive. And there are all these experts that you can access to help you do that, to help you live a really successful life. And Kinva facilitates all of that. And moving forward then, we're integrating AI and machine learning into that as well, so that that support is more tailored and more effective as well. I think just pulling the platform together probably has been a huge success for us, because it's a big platform. It's a big thing to achieve of itself, and to have it actually out with professionals, with clients and patients, and having them use it and having it improve their health and their well-being is a massive, that was always what it was about. In terms of sort of wins and successes, so we were named in the top 20 tech scale-ups in the UK recently by Tech Nation Rising Stars, so that was a huge thing. And then we did the Big Ideas, All Ireland Big Ideas pitch recently as well. We came second in that. And then way back at the start, so that was about a year ago, we got an Innovate UK grant as well. So all of those things have been really big validations of what we're trying to achieve. So yeah, they've kind of helped us keep going over the past year, you know. I think everybody talks about resilience. I think that's just a given. I think you have to be very determined. I think you need to be a bit of a blue sky thinker. I think to have that initial idea, you need to have that sort of big dream, but then be able to make it commercial and make it a viable business. And I think it's just about finding enjoyment in it as well. I think if you're motivated and you're enthusiastic and it's something that really means a lot to you, and you feel like you're really achieving something out of it, then that's often what carries you through the days when it's maybe not so upbeat or it's not so easy. Ultimately, I want Kinva to be everybody's life care wallet. It will be where people manage the experts in their life, where they can go onto their phone and they can see, right, today I've got to do this, this, this and this, and these are the interactions that I have with my experts, whatever those experts may be, a business coach, a lifestyle coach, a clinical professional, whatever it may be, but that is where you will manage those interactions. So yeah, for Kinva to be everybody's life care wallet. The hardest lesson at the start is that not everybody will get what you're trying to do, but that's okay. So there will be people who will be in your corner and who will get it and will just love it and will see the commercial viability in it and will share that big vision. And then you will have other people who just go, no, don't get it at all. But that's all right, because you have to appreciate that that's the way it is, and that doesn't mean that you have a bad idea, or that it just means that there's specific sectors and specific people that it works really, really well for. And I think if you can understand that from the get-go, then you're more balanced about it all. Best part probably is just the sense of achievement that you have from it. I think, again, going back to that idea, if it's something that you really believe in and it's something that you really enjoy, there's a huge amount of satisfaction in getting out like this and being able to talk about it and to see customers come on and getting the feedback from people. And I think that's just a really wonderful thing, and you have a lot of pride in that and in what where you're trying to get to. The hardest part at this stage is juggling all of the different roles and responsibilities that you have as a founder. It's really tough, and particularly if you're going for investment, not only are you trying to get the product together and get the team working together cohesively, but you're also thinking about where you're trying to go maybe in the next 12 or 18 months, and you've got to be cognizant of that as well. So yeah, there's a lot to juggle. So that's probably the most difficult or the most challenging part of it. I think it's just been really great, again, for the connections that we've made, and I think it's been really good actually for profile raising too. I mean, Alistair at Startacus is just so good and very, very supportive, and has connected us in with lots of people. Off the back of one of the events that he arranged as well, we had some funds approach us, which was a really great connection to make. And then we were also able to connect with a lot of other founders. So one in particular has already moved into the States, and we've had lots of conversations around that as well, and had a lot of good information from actual founders on the ground about how they did it, what they did, what they prioritised, and that sort of information at this stage has been really invaluable. I think there's not many other businesses that are actually focusing on that emerging market of life care, so it's really looking at the whole person. It's not just looking at that sort of siloed approach where we just deal with specific things in isolation or with specific people in isolation. It's really about looking at the whole person and taking a very holistic approach. And I think the fact that we're incorporating AI is also very different. Again, we're not really aware of anybody else in this space that's really doing that in this way in order to make treatment more effective and to make it more efficient. And so I think what really is different is also that we're changing that sort of delivery mechanism as well, that we're trying to change the way a lot of healthcare systems currently operate in that allied healthcare sphere. We're trying to move it into a more digital delivery and with more support around it as well. So that all of that is quite new and innovative. I think we always feel like it's a win if somebody hears about what we do and then they go off and they tell somebody else, or they know a professional that they think would be able to use the platform successfully, or an end user, a patient or a client. We work with a lot of non-profits in the States and charities that would, who really benefit from using the platform as well. So that's always a big thing for us. In terms of the actual business itself, I mean, as I said, we're looking for funding towards the end of this year. So we're really happy to get connected with any funds, anybody who's in that sort of digital health sphere. exited founders who've worked on it as well, we'd love to talk to, so that would all be really helpful.